Hello everyone, in this video we will talk about uses of chloroquine. The chloroquine is very important drug used for treatment and prophylaxis of malaria, specifically Plasmodium falciparum. First of all, you should know what is malaria. The malaria is typical of Plasmodium infection, and there are 4 species which are implicated in malaria, that is Plasmodium falciparum. So let me write Plasmodium falciparum, okay, falciparum, Plasmodium malariae, Plasmodium ovale, Plasmodium vivax, okay. The vivax is derived from word viva, okay. Falciparum, malaria, ovale, vivax. These 4 species of Plasmodium causes malaria, okay. The malarial parasite, which is Plasmodium, it undergoes primary developmental stage in liver. So the primary developmental stage of malarial parasite, that is Plasmodium in liver, is called pre-erythrocytic stage. Pre-erythrocytic, okay. And after pre-erythrocytic stage, the Plasmodium enter RBCs, which is called erythrocytic stage, okay. The pre-erythrocytic stage, which is liver, is responsible for cause of malaria, okay. The cause of malaria is due to pre-erythrocytic stage, that is liver stage, while the symptoms of malaria occurs due to erythrocytic stage. So you should have to discriminate the symptom of malaria and the cause of malaria. The cause of malaria arises from exoerythrocytic stage, and the symptoms of malaria arises from erythrocytic stage. That symptoms are headache, also can occur cerebral malaria, hepatosplenomegaly, fever, chills, rigors, okay. These are symptoms of malaria. The typical 3 characteristic symptom of malaria, which is fever, okay, fever, chills, that is sudden fever, onset of fever, and rigors, okay. These are 3 characteristic symptom of malaria, and this is due to erythrocytic stage. The Plasmodium may give rise to gametes in the blood, and these gametes can be taken by female anopheles, okay, female anopheles, and this female anopheles is responsible for transmission of malaria. These anopheles act as vector and also act as host, okay, also act as host, and in this host the fertilization of gametes occur. So this is called the definitive host, okay. Next come the some schizones. Some schizones become dormant in the liver, and this dormant hepatic stage is called exoerythrocytic stage. So you have to discriminate 2 stages. First is pre-erythrocytic stage and is exoerythrocytic stage. The exoerythrocytic stage is responsible for relapse of malaria, okay, relapse of malaria, and due to this relapse of malaria, the important Plasmodium involved are Plasmodium ovale and Plasmodium vivax. The exoerythrocytic stage is absent in Plasmodium falciparum, so that the malaria caused by Plasmodium falciparum does not relapse. The drugs used for treatment of or prevention. The prevention of malaria is also called prophylaxis of malaria. The drugs used for treatment and prophylaxis of malaria are further divided into subgroups depending upon the main stage they affect, okay. First is primary tissue schizones. Primary tissue schizone. Primary tissue schizones. The primary tissue schizones, these are the drugs which kill schizones in the liver, okay, schizones in the liver, and the principal drugs involved are proguanil, primaquine, and pyrimethamine 3P, which are tissue schizonoticides which kill primary tissue schizones. That means they kill schizones in the liver. These drugs are used for casual prophylaxis, okay, casual prophylaxis. Next come the erythrocytic schizonotocide, which kill RBCs schizones. That means these drugs kill schizones in the blood, and they can be used for treatment of acute attack and also used for suppressive prophylaxis. Okay, prophylaxis is prevention of disease, is called prophylaxis. Okay, so the main important drug which is used in this class is artemisinin. Okay, artemisinin, while chloroquine and quinine also belongs to that class. Also belongs to that class. All of these drugs are used for treatment of malaria but not for long-term prophylaxis. The artemisinin and chloroquine and the quinine are blood schizontocide, so that we can write erythrocytic schizontocide, which are the quinine, chloroquine and the artemisinin. Okay, artemisinin. The erythrocytic schizontocide may be fast acting or slow acting. The chloroquine, quinine and artemisinin occurs or belongs to fast acting, while slow acting once again include proguanil, pyrimethamine, sulfonamide and tetracycline. They are slow acting erythrocytic schizontocide, and the famous and important mnemonic is, let me write, the important mnemonic is, the Urdu meaning of mosquito is machhar, M-A-C-H-A-R, machhar. Okay, M for mefloquine. These are fast acting erythrocytic schizontocide. M for mefloquine, A for atavocone, C for chloroquine, H for halofentine, A for artemisinin, and R for respiratory caution, that is quinine. Okay, these are fast acting erythrocytic schizonticidal drugs. Okay, the sporonticides include proguanil, pyrimethamine, which prevents sporogony and multiplication in the mosquito. Okay, and they are exoerythrocytic schizontocide, which kill exoerythrocytic forms of Plasmodium ovale and Plasmodium vivax. These include primaquine. Okay. Last is sporanticide or gametocide. These drugs kill gametes or spores and they prevent transmission of malaria. These include proguanil, pyrimethamine, primaquine, artemisinin. Okay, these four drugs kill gametes of both Plasmodium vivax and Plasmodium falciparum, while chloroquine, mepecrine, and quinine kills the gamete of Plasmodium vivax only. Okay, coming to the topic of chloroquine. Let me write chloroquine, and the mnemonic is my red lip. So focus on this diagram, my red lip. M for malaria, so it's a typical anti-malarial drugs, but also can be used for other conditions like amoebiasis and some other conditions. But we should know something about chloroquine. Chloroquine is actually a 4-aminoquinolone derivative, and this is an anti-malarial drug which has highest volume of distribution. It accumulates in the food vacuoles of Plasmodium. Okay, and it is selectively concentrated into the parasite erythrocyte. The main mechanism of action is it prevent the polymerization of heme to hemazine, so that heme accumulate, and due to accumulation of heme this proves cytotoxicity to the parasite. So it is a drug of choice for the treatment and prophylaxis of known falciparum malaria. I am repeating, it is used for prophylaxis and treatment for susceptible Plasmodium falciparum and but not for resistant Plasmodium falciparum. Okay, and it is also used in the treatment of Plasmodium vivax and Plasmodium ovale, but it doesn't inhibit the exoerythrocytic phase of Plasmodium vivax and Plasmodium ovale, which are responsible for relapse of malaria. Okay, relapse of malaria. So it is used for non-falciparum malaria and chloroquine sensitive Plasmodium falciparum malaria. What this drug do? It is an erythrocytic schizontocide, which inhibit the erythrocytic stage, and it has no effect on exoerythrocytic stage, so it is not useful in the treatment of relapsed malaria. It can be used for other conditions. So the mnemonic is my red lip. First is malaria. What type of malaria? Non-falciparum malaria and chloroquine sensitive Plasmodium falciparum malaria, but it can also used for other conditions like rheumatoid arthritis, my red lip, rheumatoid arthritis. Okay. E for extraintestinal amoebiasis. Okay. So the tissue amoebicide are chloroquine, amethine, metronidazole and tindazole. Okay. The mnemonic is CAMT. So the DLE is discoid lupus erythematosus. L for lepra reactions. And next is infectious mononucleosis, which is caused by Epstein-Barr virus. And next is photogenic reactions. It also used for giardiasis. Giardiasis. Okay. The mnemonic is my red lip. So after covering the chloroquine, we should know the toxicity of this drug. What this drug do in high doses is it causes peripheral neuropathy. It also causes hypotension. It also causes myocardial depression. It causes changes in T wave, auditory impairment, and the prolonged uses of this drug can cause blindness due to retinal damage, and this type of condition is called bull eye maculopathy. My writing is too much bad. Red eye, okay, sorry, bull eye maculopathy. It also precipitate porphyria. Okay, so this should not be used in the patient of porphyria, and they causes discoloration of nails and mucous membrane of oral cavity. Okay, the chloroquine is the drug of choice for the treatment of malaria in the pregnant woman. Okay, while the standard drug for the cure of all chloroquine resistant malaria is artemisinin. Okay, artemisinin. They are metabolized in the food vacuole of parasite, forming toxic free radical. The artemisinin is blood schizontecide. Okay, active against Plasmodium falciparum, including multi-drug resistant strain. Okay, so they are first choice for chloroquine resistant malaria. Okay, chloroquine resistant malaria. They are also used against quinine resistant malaria. The adverse effect include nausea, vomiting, diarrhea. Okay, and they causes some little bit abortion in pregnant women. Okay, so this was all about chloroquine. Hope you have liked this video. Please subscribe our channel and stay tuned.